Welcome to a comprehensive guide on healthcare policies and procedures, a fundamental framework for delivering consistent, high-quality care across healthcare organizations. Policies and procedures form the foundation of a safe, effective department. They standardize care, guide decision-making, and help teams operate efficiently, even under stress. A policy is an officially approved rule, while a procedure describes how that rule is implemented in day-to-day practice. Departmental leaders play a key role in writing, implementing, and evaluating policies that span both clinical care and operations. In our healthcare society, consistency is critical. Policies and procedure support evidence-based practice, define expectations, ensure accountability, streamline orientation for new staff, help teams coordinate care across departments. In high-stakes environment, having standardized guidance keeps teams aligned. When starting from scratch, begin by consulting your institutional policy office if available, building a policy development team with designated section owners based on expertise, creating templates to ensure consistency in language and format. These steps support smooth policy creation and update cycles. Great policies are clear and concise, easy to find, written in plain language, focused on what to do, not how to do it. That's the procedure's job. Best practices for writing procedures include linking each one to parent policy, testing clarity by asking frontline staff to explain the procedure, identifying a content owner for questions and updates, ensuring factual accuracy and regulatory compliance. Standardized templates help teams locate and understand policies faster. Examples: use headings like title, purpose, policy statement, and procedure. Label documents constantly, for instance, ADM 01 for administrative, CL 01 for clinical. Maintaining a clear digital index improves access and keeps content updated. Beth Israel's Medical Center uses a structured process called PPGD. Policies, procedures, guidelines, and directives. It includes development plans, sponsorship by senior leadership, oversight by committees, scheduled reviews and compliance monitoring, content management systems for tracking and revision. This model ensures all policies reflect actual work practices and regulatory expectations. The approval process involves drafting, cross-departmental consultation, committee and board review, staff education and rollout. Policies should be reviewed every 1 to 3 years, depending on their scope. Leaders must track who was informed of changes and confirm staff understanding. Even the best written policy fails if staff don't know about it. Use team meetings, online learning models, attendance tracking, one-on-one coaching on department experts. Leaders must ensure staff not only receive information but can also apply it in practice. As a department leader, you must approve and request new policies, ensure compliance with regulations, align your team with organizational standards, advocate for education and clarity in implementation. Policies support patient care, safety, and consistent decision-making in unpredictable environments. Agencies like the Joint Commission assesses hospitals by interviewing staff, reviewing documentation, and observing care. Surveyors now expect more than just written documents. They want to see that staff can locate and follow policies in real time. Leaders must prepare teams to explain their processes and demonstrate alignment with standards. Real-world case example. In one hospital, A policy stated that the ED patients in the waiting room should be re-evaluated every 30 minutes. But during a regulatory survey, patient went unchecked for over 40 minutes. Result: a misalignment between policy and practice flagged for correction. Lesson: don't set standards your team can't realistically meet, especially during peak volume. Every year, review all policies. Are they still relevant? Do they reflect actual practice? Maybe they need an update. Can any of them be merged or retired? Engage admin support to schedule reviews, organize revisions, and track updates. Keep a record of all committee approvals and revisions. After implementation, quality assurance processes ensure policies are working. Hold regular case reviews. Involve multidisciplinary quality assurance teams. Use documentation and patient records to identify gaps. Update policies based on new evidence or trends. Linking quality data to policy compliance strengthens patient safety and team performance. Auditing cases, mentoring clinicians, and standardizing care all fall under your leadership umbrella. Ask yourself, would another provider make the same decision? Can we reduce variation with a clearer policy or a guideline? Are our systems helping or hindering care? Use case reviews as teaching moments and system improvement opportunities. In Massachusetts, ambulance diversion was banned. Hospitals had to design internal plans for responding to the emergency department overcrowding. A cold help policy was developed, a tiered response with clear roles for ED staff, inpatient services, case management, hospital command center. The result? A coordinated hospital-wide effort to decompress the emergency department and protect patient safety. Leadership tips: involve staff at every stage, schedule regular policy evaluations, track all policy dates and versions, clarify the difference between a policy, procedure, and guidelines. Set realistic standards that match operational capacity. When policies work for your team, not against them, your department thrives. In conclusion, policies and procedures are more than documents. They are tools for quality care, risk reduction, and efficient operations. Leaders must write clearly, implement constantly, educate proactively, review regularly, and measure success rigorously. And above all, engage your team in the process. Thank you for joining in this session for policies and procedures.